Hi everyone, I am Dr. Reshavardhan from Department of Transfusion Medicine, Narayana Medical College Hospital. Today I am here to talk on hemophilia because on the event of World Hemophilia Day. Every year on April 17th we will celebrate World Hemophilia Day in the honor of Frank Snebel, who is the founder of World Hemophilia Federation. Every year WHO announces a theme for the Hemophilia Day. This year's theme is Access for All, Policy, Progress, Engaging Your Government, Integrating Inherited Bleeding Disorders into National Blood Policy. Based on this theme, the government is able to raise awareness and integrating hemophilia and other bleeding disorders into the attention of policymakers. Thereby, we can deliver accessible, equitable and sustainable treatment to the patient. Hemophilia is the word which derived from Greek, that is hem means blood, philia means love, that is blood love. It is usually manifested as clotting factor deficiency. Because of this clotting factor deficiency, there is prolonged bleeding at the time of surgery or at the time of injury. Sometimes because of severe clotting factor deficiencies, there is a spontaneous bleeding into the joints and brain. Based on the clotting factor deficiency, the hemophilia is classified into hemophilia A, hemophilia B, hemophilia C. Hemophilia A is due to deficiency of factor 8. Hemophilia B is due to deficiency of factor 9. Hemophilia C is due to deficiency of factor 11. Coming to mode of inheritance, hemophilia A and hemophilia B will be inherited as X-linked recessive disorders. Because of this X-linked recessive disorder, usually the male children are going to be affected, whereas hemophilia C will be inherited as autosomal recessive. Coming to the incidence, usually hemophilia A occurs in 1 to 5,000 male childbirths, whereas hemophilia B occurs in 1 in 40,000 male childbirths. Coming to based on the deficiency of clotting factors, like level of clotting factors, this hemophilia is classified into mild, moderate and severe. In case of mild clotting factor deficiency, the factor usually varies between 5 to 50% of activity. Coming to moderate, the clotting factor level will be 1 to 5%. Coming to the severe clotting factor deficiency, the clotting factor level will be less than 1% of clotting factor activity. Coming to signs and symptoms, usually the mild clotting factor deficiency will be manifested at the time of major surgery or at the time of major trauma, or sometimes during the dental procedures. Some patients may complain of bleeding from the gums at the time of brushing the teeth. Coming to moderate factor deficiency, it usually manifests when the child start walking. Because of repeated falling and bumps, we will notice the bruises and hematomas all over the body. Coming to severe clotting factor deficiency, it usually manifests with a spontaneous bleeding into the joints or brain. Even the minor trauma also leads to the bleeding into the muscles. Whereas coming to complications, because of severe clotting factor deficiency, sometimes there is severe spontaneous bleeding into the joints and muscles. Because of bleeding into the joints, there is a damage of cartilage and repeated synovial synovitis, which in turn leads to the permanent disability of the joint. Whereas bleeding into the muscles, which in turn leads to the large bruises, sometimes severe pain and numbness at the site of bruise. Because of spontaneous intracranial bleeding, which in turn leads to the headache, seizures. In some cases, there is a loss of consciousness. Because of replacement of clotting factor by using fresh frozen plasma and cryoprecipitate, there is a chance for patient acquiring transfusion transmitted infections because of these blood transfusions. Coming to diagnosis, so diagnosis of these clotting factor deficiencies will be done at 3 stages. That is before pregnancy, at the time of pregnancy and after delivery. Before pregnancy, the couple who is married should undergo a genetic testing and the counseling. Based on this, whether they can conceive or they can stop conceiving based on their genetic status. Coming to diagnosis at the time of pregnancy or during the pregnancy, It is mainly by the chorionic villus sampling, which will be done at 11 to 14 weeks of pregnancy, or by doing amniocentesis at 15 to 20 weeks of pregnancy. Coming to diagnosis of clotting factor deficiency after delivery, mainly by estimation of levels of factor 8 or other clotting factor deficiencies, or by doing the partial thromboplastin type, which usually increased in case of these clotting factor deficiencies. Coming to treatment part, the mild cases can be treated by giving the desmopressin. So desmopressin will lead to or activate the production of factor 8 from the endothelium, and mild cases also treated by giving antifibrinolytic agents like tranexamic acid and epsilon aminocaproic acid. Coming to treatment of moderate to severe cases, it is mainly by replacement of commercially available factor 8. If there is non-availability of this commercially available factor 8, then we can go for cryoprecipitate or fresh frozen plasma for replacing this clotting factor deficiency. In 30% of cases, there is a chance for formation of antibodies to this commercially available factor 8. In those cases, the patient can be treated by giving recombinant factor 7A or by giving prothrombin complex concentrate. If patients develop antibodies against factor 8, the patient can be treated by immunotolerance mechanisms or by giving rituximab, which will inhibit production of antibodies, or we can give intravenous immunoglobulin to neutralize the antibodies. The treatment modality which is under research is gene therapy. Here the gene therapy is under phase 2 trials, where the patient can be treated at the genetic level by replacing the genetic defective gene with the normal gene. The subsidiary treatment which can be given to patient is the painkillers, which does not interfere with the clotting mechanism, and steroids in some cases to inhibit antibody production, and physiotherapy to prevent prolonged joint damage. By giving proper treatment, the child will lead a normal life, and the life expectancy will be 10 years less than the normal life expectancy. So the patient who is undergoing treatment for factor 8 replacement or clotting factor deficiencies, that patient should not take any drugs which will interfere with the clotting mechanisms like heparin and warfarin, or the drugs which inhibit the platelet function like aspirin. So by giving the early and proper treatment, the child can lead a normal life. Many voluntary organizations working on par with government for proper management of hemophilia. So the patients who diagnosed with hemophilia should be registered with these voluntary organizations or government hospitals to get regular commercially available factor 8 treatment. So by giving the proper treatment can save a child's life, and he or she can lead a normal life. Thank you.